We've seen the problems with food deserts in some of our Houston area communities. Whole neighborhoods with limited or no access to healthy foods. It's been a big problem and one that's being tackled by the Healthy Houston Initiative program by Texas A&M and Prairie View A&M. Joining me this morning, Dr. Gerard D'Souza, the Prairie View A&M Dean and Director of Land Grant Programs, the College of Agriculture and Human Sciences. That's a mouthful, but it's important. And Dr. Carolyn Williams, the Executive Director, Associate Director of the Cooperative Extension Programs at Prairie View A&M. Good morning to both of you. Dr. D'Souza, what is the Healthy Initiative Program all about?
Well, good morning, Kimbrell, and good morning, Houston. So glad that you could have us here this morning. So the Healthy Houston Initiative is a partnership among the Texas A&M University system, Prairie View A&M University, and several colleges within the university, as well as the City of Houston and Mayor Turner's Complete Communities Initiative. And the idea is to improve the health, wellness, and nutrition of selected underserved communities in the greater Houston area.
Dr. Williams, how are the communities determined that need the support? How is that process done?
Well, good morning, and thank you for allowing us to share this information. The communities were selected for year one, addressing some of the concerns that were identified in the Complete Communities Data Report. And so for year one, we will be addressing some of the food needs and nutrition and wellness programs, engaging youth and adults in a variety of activities to enhance their nutrition, about wellness and how food is a part of being well.
How is that implemented? I mean, it sounds important, it sounds wonderful and broad-reaching, but how is that implemented? What's the plan in actually getting it on the ground to the people who need it?
Well, we have already partnered with several agencies, churches, local businesses to help us identify audiences, and we will be doing virtual and face-to-face programs in all of these areas. We have one of the most amazing Heroes for Health, where we train teams to become ambassadors to health, and they will get the younger kids involved. But we also have our College of Nursing that will be offering some telehealth screenings. We will use our other partnerships to make sure that we are addressing some of the needs that were identified in the Complete Communities Report. So we will be in the communities in areas where we can conduct programs, but we will be doing a lot of virtual as well. And we've seen some success in that in our 4-H and our nutrition programs already.
Dr. D'Souza, talk about the way Prairie View oftentimes doesn't get mentioned like it should be for its agriculture impact. It is amazing in what it does. Talk a little bit about what the university does and really how it really makes an impact in our communities.
Thanks, Kimbrell. I appreciate the opportunity to do so. So the College of Agriculture and Human Sciences is a foundational college of Prairie View A&M University. We're almost 140 years old, and we are the only comprehensive agricultural college in the greater Houston area. And what that means is, by virtue of our land grant mission, we're able to serve the community in addition to serving students on campus through our academic mission. We have a research mission, and we also have an outreach or service mission that Dr. Williams just talked about, which is taking the results of discoveries on our campus, including, in our case, food security, which is one of our signature programs in the College of Ag and Human Sciences. We also have labs in which we make discoveries about how plants can be made to be more nutritious, about the pathways to health and wellness, and growing under a variety of conditions, including drought and weather extreme and climate change. And I know you yourself are a climate geek, as you call yourself, so you can appreciate how we need to make plants, animals grow under extreme weather conditions to be able to meet the needs, the growing needs of inner city Houston and beyond.
Great work being done there. How do people, if they have seen this program and they say, well, I think I'm in an underserved community, I'm not sure, how do they find out if they fit into this program or if there's a way for them to fit in? Either one of you, Dr. Williams, do you want to take that one?
Yes, we do have a website on the Prairie View webpage that you can send any inquiries to. We also have the Harris County Extension agents available to answer questions. The College of Nursing Any of those in the Houston area will be able to point them to the right contacts, and we will follow up and make sure that they're included in this program, because it is a health and wellness initiative for adults and youth.
And boy, don't we need it now. After this year, it's
Yes.
we need to be healthy mentally and physically, and you guys are a big part of it. Thank you for being here. Dr. Gerard D'Souza, Dr. Carolyn Williams, thank you for what you're doing. I must say, as I was telling you before we started recording this, if you have not been to Prairie View A&M's campus, you owe yourself a trip. It's not very far from the Houston area. Get out there. It's an amazing campus, amazing history as well. Thank you so much for what you're doing. I look forward to hearing some positive feedback from this. Let me know if there's something more we need to talk about. You'll let me know, won't you?
Yes.
Absolutely.
Thank you.
Thank
One
you.
of these days, we'd love for you to come on campus and broadcast from the campus, including our campus farm.
All right. I'll come out. I'm ready to get some fresh vegetables when I do.
Certainly.
All right. Thank you so much. We appreciate you, and thank you for what you're doing to make a difference.